What strategies do you use to manage dental anxiety in patients, especially children or those who have phobias?
Yeah, a lot of people have been scarred by dental procedures when they were younger, even as a more of an adult. It's a real thing. I think what doesn't help is a lot of times people go out and just. When's the last time you actually heard anybody volunteer? Like, this is the greatest thing ever. I went to the dentist, this is the best. Very, very rare that actually happens. Most of the time, people go and talk, oh, God, I had to get a root canal, get my tooth pulled. That's horrible, it's terrible. Well, and that's all you hear. Well, of course, that's all you hear because no one goes says, oh my gosh, I had a tooth pulled and it was the best experience ever. So it already has a lot of bad fuel or feed into the patient's head or thinking. So in order to combat that, it's really trying to, when you hear it, I like to investigate it, ask questions about what happened. I like to do different techniques to, when I give an injection, to have them relax, through a touch on the shoulder, to relaxing the cheeks, to be able to think about things and breathing. Incorporate like things like from yoga or from massages into the dental practice by little subtle techniques that you don't have no idea that may be happening, but it helps calm down the nerves. Always, putting power in people's hands. Say, hey, you need to stop. You have a hand to raise up. I'll stop right away. So just really working through the patient to make them as comfortable as possible to get through the procedure and work really efficiently. The last thing you want to do is to have do a fill-in that's really, really simple and it takes you 40 minutes. When I can get it done in 10 minutes, that's a lot easier on the patient. So a lot of things are involved, but that's just how I kind of think and walk through, making people more comfortable.
What is your approach to working with multidisciplinary team, including orthodontists, industry, interest, periodists, and other specialists to provide comprehensive care?
Yeah. So we love being an all-encompassing service to our patients. We want to be able to provide I call it 97% of the care at our office. And that involves a lot of training to understand how different things work together. And it's actually a great thing to be able to do that because you have all these different specialties, but you lose that sense of oversight of the patient's health when you send them off to a specialist, like an oral surgeon or to the periodontist. And a lot of times people don't want to go do that because that's more of a hassle, inconvenience, and cost them more money. So if we're able to do the service of very, really good quality, when it's in our scope of work we can do and make sure we get the good results we want, it only makes sense to have that oversight of the patient's goals and motivations and treatment to make sure we get to where they want to get to. So most of the time we keep stuff at Modern Family Dental Care. If it is like a tooth that had a root canal from before from another doctor, that's one thing I just don't do. So I would send them off to an endodontist if they want to keep the tooth. Another thing is like gum treatment. There's so many different types of cleanings. If we can do the cleaning in the house and not send them off to the other periodontist or gum doctor, we'd like to do that because ultimately we know that we take care of them in-house, they'll be taken care of. Once we refer, who knows what will happen.